Abounding Prosperity is almost 20 years old, go figure. Its sole purpose was to support ending the HIV epidemic for Black men who have sex with men, and the mission has since expanded to include Black women and transgender women, as well as their families. So of course we do comprehensive prevention and care. We have a number of mental health programs. We also support folks who are engaged in substance use, folks who need housing assistance. We have HIV care programs that bridge into long-term care with our partners. So the list goes on and on. And we also have like a large referral network. So we partner with other organizations in Dallas County, which really does expand the notion of the work.
So with this initiative, we really want to focus on increasing, the testing of those who have never been tested for HIV. So those populations that have never taken an HIV test before, feeling confident, feeling like there's no stigma. I have the confidence and, that ability to get tested and know where to go in my plan of action. Being able to support programs like this that are able to really advance increasing testing in populations is really the way to go, for us to be effective at combating, ending the HIV epidemic in the United States.
The overall purpose was to expand what it is we were already doing. I know historically we've been the folks providing interventions, i.e. HIV screenings, and so we're in the trenches giving community HIV screenings. We have opportunities for folks to come in-house to receive screenings, to our clinic as well as our administrative offices. Then again, there are those folks who don't necessarily feel comfortable for whatever reason. There are those folks that we're just not reaching. And so this collaboration was an opportunity to meet the folks where they were. It's just an opportunity to get us a little deeper in the pockets of community that we're not into right now.
One of the focuses that we have with this particular program is navigation services. It looks like you being educated first about, your result, your test result, but then also finding areas where you can get connected to care. So that could be a local community-based organization, maybe one of the providers where the person receives, one of these self-test kits, but then also CVS, pharmacy minute clinics actually, provide, HIV testing follow-up as well as PrEP consultation, which is another community option for people who want to follow up after their testing. Some of our partners are actually providing self-kits at their physical brick and mortar locations where individuals can pick it up. So many of these organizations do participate in local health fairs where they'll also be disseminating those test kits, which are free of charge.
Folks don't come to facilities all the time, so that's why it's important to take the access to where folks are, to where they party, to where they live, just reimagining the pathways into access so we can achieve health equity.
We view health equity not just as a series of programs, but really how we do business, really how we interact with the community. How can we really reimagine, redefine healthcare? And that's really is putting community at the center and at the solution, of how we're able to really tackle many health disparities that people face day in, day out in this country.
Some of the successes and challenges that we find through the partnership with the initiative, they won't be the same as other folks find. So I'm mostly interested in to see how it impacts health outcomes, how we can expand the project, and in what ways we can make it scalable, utilize this and kind of promote it with our partners, because not everybody is doing self-test kits. Currently, it's been really effective with us. We actually just ran out. So I know that it's working. Now it's okay, this is a new strategy. There may be a little something here, so we just need to see what it looks like, specifically for Dallas County. So I'm interested to see what successes we can have and how we can better serve communities that really could benefit from what the self-test kits do.